You've been told you have a thyroid nodule, which is a growth in the thyroid gland located in the lower part of the neck. It should be comforting to know that about 90% of the time these nodules are benign, not cancerous. But in order to verify this, your doctor will need to collect some cells from your thyroid nodule through a fine needle aspiration, or FNA biopsy. If you're like most people, you might be a little nervous about this procedure. You will be asked to lie down with your neck extended and briefly hold your breath while your physician inserts a very thin needle into the nodule to remove a sample of cells. You will feel some pressure and slight discomfort, similar to when you get blood drawn. But that's all. It sounds worse than it is. And after about 20 minutes, the procedure is over and you can go home. There should be no lasting effect, but you might have a bit of bruising or swelling at the biopsy site. If you do, your physician may suggest that applying ice will help. Your biopsy sample will be sent to a lab to be examined under a microscope. In most cases, the results are clearly benign, meaning the nodule is not cancerous. In the rare event that the results are malignant, meaning cancer is present, the long-term survival rate is generally very high. You should be aware, however, that sometimes biopsy results are not clearly benign or malignant and are instead called indeterminate. In the past, indeterminate results usually led to a surgical removal of part or all of the thyroid. But new advancements in genomic testing are able to help clarify many of these indeterminate results and reduce the need for surgery. Afirma Gene Expression Classifier is a genomic test that can be done simply by obtaining an additional sample during your initial biopsy. It will evaluate the genes in your thyroid nodule in order to help your physician give you a more definitive diagnosis, and will only need to be analyzed if your biopsy is indeterminate. This proven test has already helped tens of thousands of people avoid repeat biopsies, unnecessary thyroid surgery that may require lifelong medication, and the anxiety caused by indeterminate FNA results. Afirma testing is covered by Medicare and most major health insurance plans. The providers of the Afirma test are committed to ensuring all patients have access to the test regardless of their financial circumstances. The Afirma Access Program provides financial assistance to those who qualify. Your physician will provide you with an educational sheet which includes an Afirma Access application on the back. So let's summarize. The FNA biopsy is a safe procedure that is used to determine if a thyroid nodule is benign or cancerous. Try to relax. It only takes a short time. There should be no lasting effects, and the majority of results are benign. If the result comes back as indeterminate, your physician will have already collected additional samples for the Afirma testing, which may help you avoid surgery. If you have any questions, please call 1-888-9-AFIRMA or visit www.afirma.com.